hired, but now some nurses are saying they're running into a bigger staffing shortage, but this time because of the vaccine.
Eyewitness News reporter Stacey Rasmussen talked to a local nurse who might lose her job because she's refusing to get the vaccine and says she's not the only one. Stacey?
I talked to Krisha Gurley, who says a good amount of people in her department are also refusing to get vaccinated, which could add to the nursing shortage we are already experiencing. The biggest reason she doesn't want to get the vaccine is because she believes the government and her employer should not be allowed to make her medical decisions.
Once you give those rights away, it's very difficult to get them back.
Krisha Gurley, a Bakersfield nurse, does not want to get the COVID-19 vaccine, yet is required to by the state of California.
My personal life choices should not have to be dictated by the profession that I choose. I don't think it's fair to require medical treatment to anybody who doesn't want it. Nurses included.
Her, as well as some of her fellow nurses, are putting their foot down and are willing to face the consequences in order to have medical freedom.
If I end up in a position that they tell us, we're not going to offer you the exemption, or your exemption is denied, and you have to get the vaccine or you're fired, then I will get fired.
Bakersfield Memorial Hospital says it will review all of the medical and religious exemptions.
At the end of the day, I believe all of the hospitals are going to work in good conscience to make sure that they are fair and equitable.
Since this is a statewide mandate, she will not be allowed to work in the healthcare field in the entire state of California. Gurley also said there are a lot of nurses who are in the same boat as her, which will result in a horrible nursing shortage.
We are already extremely short. We already can't get to full staffing, even bringing in traveling nurses.
Bakersfield Memorial Hospital agrees this could be bad.
I can tell you it's going to be very difficult to overcome, a loss of 10%, 12%, 15% of the nursing and caregiver staff and still provide the level of care that we're providing.
And Gurley says the whole situation is demoralizing and she feels underappreciated since last year she was considered a hero for working during COVID, and now she will most likely lose her job.
We know that our healthcare providers are able to provide safe, good care to our patients for the last 18 months. What has changed? If we could do that without a vaccine, why now is this mandate necessary? So it just feels a little bit like manipulation.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.